So this is part 1 of the resuscitation series. Mr. Rajesh Kumar, 58-year-old male patient. He was found collapsed on his kitchen floor, brought by ambulance to our emergency department. Time taken to reach the hospital was near about 10 minutes. On arrival to the emergency department, no response, no central pulse, that is carotid or femoral pulse, and gasping breath. This is cardiac arrest. Cardiac arrest is recognized when the patient is unresponsive, pulseless, and has absent or abnormal breathing. This patient needs CPR now. So this is what agonal breathing looks like. It is also called a gasping breath. So what do we do in this case? First, check response. Shout, tap. No response, look, listen, and feel. What are you going to look for? You're going to look for the chest wall movement. What are you going to listen for? You're going to listen for breath sounds. What are you going to feel? You're going to feel the central pulses, that is the carotid pulse and the femoral pulse. Then, if there is absent pulse, call for help and activate the emergency response system. Usually, it is code blue in most hospitals. Third, begin high quality CPR. Push hard and push fast. In the center of the chest, at the lower third of the sternum, 5 to 6 centimeters deep, 100 to 120 beats per minute. As for the position of chest compression, arms should be straight, shoulder over the hands, and elbows locked. What do you do next? Monitor rhythm every 2 minutes. Shock if the rhythm is shockable. Insert an advanced airway and confirm the placement of the airway. Once in, give one breath every 6 seconds. Make sure you do not hyperventilate this patient. What is the main drug in cardiac arrest? That is adrenaline. You give 1 milligrams of adrenaline every 3 to 5 minutes. Start adrenaline as early as possible and give it as regularly as possible. If the rhythm remains shockable, add amiodarone after the third shock. Don't forget, search for and treat the reversible cases of cardiac arrest until there is return of spontaneous circulation. So the question might come to you, why attach a defibrillator during a cardiac arrest? It is to check if the rhythm is shockable or non-shockable. If the rhythm is shockable, like ventricular fibrillation or pulseless ventricular tachycardia, develop one shock immediately. Resume CPR for 2 minutes right after the shock, no pause. When ROSC is achieved, shift the patient to post-resuscitation care. Ensure oxygenation, support BP, search for the cause, and consider targeted temperature management to protect the brain.